Okay, here we're going to talk about radiation in veterinary medicine. Katie and I broke this up into two parts because of mostly my difficulty being able to figure out how to upload this. Um, so I'm going to start here with part one. A little review. What is cancer really? Um, well, this funny photo here of this child being disrespectful is a little like how cancer acts. It's insubordinate, disrespectful, delinquent who doesn't follow the rules. um, Cancer cells ignore normal body signals. We learned about apoptosis, which is normal cell death, and with this, when a cell is no longer functioning properly, the cell should uh, be signaled to die and disintegrate, but that doesn't happen with cancer cells. Uh, there's also contact inhibition. When cells get in contact with each other, they're signaled to stop proliferating, and this stops cells from toppling on top of each other and continuing to grow. However, cancer cells ignore these signals. Then we have self-signaling. This is where cancer cells become very interesting and almost take on a life of their own, because they have the ability that even if they should be turned off and not able to proliferate, they can turn the signals on so that they're able to proliferate even more. So really they have control of themselves, which is very strange for normal body functions. Now, what is radiation? Radiations are basically energy particles that are able to penetrate surfaces depending on the level of energy. We can remember from Dr. Lukowski's class the cathode and the anode and the tungsten, all of those things that cause atoms to generate energy, and then that energy is able to penetrate surfaces. Now, normally we have radiation in nature, such as the sun, and then also it occurs in our everyday lives, like wireless devices, microwaves, and radios. This is stuff we don't necessarily notice right away. But it also can be ionized, and this is where our X-rays and gamma rays come in. So when it's ionized, it produces charged particles, and this is where we can get in some really good stuff with medicine. What happens when you use radiation on cancer cells? Well, the high energy particles, which are also measured in waves, target the cancer and kill the damaged and mutated cells, which is what we want. We want some way to stop these cancer cells from proliferating and basically telling itself what to do. So we have some benefits with radiation. There's less damage to surrounding tissues because you're focusing on a specific area of the tumor. You think of chemotherapy. Yes, it works, but it also affects a lot of other healthy tissue. So with radiation, you're able to focus it a little more so you're not doing as much damage. However, if you have a very aggressive type of cancer, you can use it with chemotherapy in order to combat that type of cancer. Is there more than one type of radiation? Absolutely. The three main ones that we're going to discuss here in veterinary medicine that are used is teletherapy, or external beam radiotherapy, brachytherapy, and biologically targeted radiotherapy. Now, there's many more options out there, especially in human medicine with advanced technology, but currently, for right now, these are the most commonly used in veterinary medicine. So a little introduction here, veterinary medicine and radiation therapy. Obviously, in human medicine, as mentioned previously, things are a little bit different because we're talking about humans, not that animals are less important than humans, but it's just handled a little differently, especially if you have a client who may have difficulty financially. These procedures can become pretty expensive. Now, whether human medicine or veterinary medicine, your most important and best chance of preventing spreading with a tumor is to just remove it surgically. This way, you're encapsulating the entire tumor and getting out all those little tiny cells that are causing these problems. So, when surgery isn't possible, there are some considerations you need to take. For example, a tumor near a vital organ could be a possibility why you cannot perform surgery, such as lungs, heart, spinal cord, or brain stem. And even the eye, depending on the situation where the client may or may not want removal of the eye. This picture of this cat here shows tumors around the eye. Now, you could surgically remove these, but that would cause a lot of scarring. And again, as mentioned before, it's different with human medicine. This could be a situation where the client just doesn't want those scarring around the eye. And it may be a situation where there's a tumor behind the eye, where it might be a better option just to remove the eye. Either way, it depends on the situation. So you might need to use radiation for certain types of tumors, especially around the lungs and heart. Also, underlying medical conditions. Perhaps you have an animal that you don't want to put in surgery because of perhaps liver problems, issues with anesthesia that could potentially happen. Then we have age. Obviously, geriatric patients are a whole new class of patients that you need to take in consideration what their problems might be in surgery. So if radiation is your option, it can be used, but you need to really evaluate the patient for any of these situations. Depending on the type of tumor, it will depend the type of radiation therapy you want to use. So you need to really give the patient a really good evaluation and determine their history with the client so that you can make all of these decisions. Again, you can use all of these in conjunction with chemotherapy. Modalities. So these are the modalities we're going to discuss. We have teletherapy, which is external beam radiotherapy. One funny little thing I'd like to note is that nowadays with new technology, certain words are being used for different types of medicine. So when you search teletherapy in human medicine, it's actually considered a therapy over the internet. In other words, communication therapy, where you can talk to a therapist over the computer. So that might be a thing where we want to use the external beam radiotherapy term in this case. So basically, the EBR, external beam radiotherapy, is where high doses of radiation are targeted specifically at tumor locations and delivered by an external source. So you think of like an X-ray machine, but much, much more targeted. That's what this is. Brachytherapy, this is really fascinating, and we're going to discuss this in more detail, but small doses of radiation are implanted within the tumor, and these can be temporary or permanent. Then we have biologically targeted radiotherapy. This is radioactive therapeutic agents that are delivered biologically to the cancer area. And this is where nuclear medicine meets radiation. How does it work? We have teletherapy, as discussed, is an external source focused on that tumor site. So here you have a little cat at Cornell University where they're directing a small device at the tumor. But more commonly, to the right here, again, this is used in human medicine as well, but these are also in veterinary hospitals. You have this device that is attached to the wall, and then you have the plate where you lay the patient down. And this machine rotates around the tumor. So you have a beam that is directed at that spot, and it contours around the tumor so you can get all of the tumor in this case. So again, external beam radiotherapy. Here's some photos, one in a veterinary hospital of the same device. You can imagine how expensive these must be. So they're specially designed like an X-ray machine, but using linear acceleration. Now this is directed at the tumor, and again, as I said earlier, it contours or shapes around the tumor to make sure every spot is directed at. Some machines are better than others, reducing scatter radiation to healthy cells, and it really depends on the type of machine, but for the most part, they're all very good, but they're also very expensive, so it depends on the facility, what they choose to purchase. Brachytherapy. This is really interesting stuff here. So this is where they use small radiation and they implant it within the tumor. So you have these applicators that are the size of a grain of rice and they're implanted into the tumor. In human medicine, they're used a lot for prostate cancer. So here's just an interesting photo of some applicators that are within that tumor area. So let's discuss some other options here. So again, brachytherapy. Here is a photo showing how the applicator is being placed temporarily near or within the tumor. Now, with temporary, they're used only for a few minutes next to the tumor. So it's a little bit of a higher dose, and it's sent in bursts. And then the applicators are removed. But with permanent, you actually implant them within the tumor, and then the tumor slowly releases radiation over time. This is often like a slow release pill that you might give to a patient. So generally it takes about 3 months for the radiation to be totally released from the applicator, and it's permanently put there. And how it works is it works by destroying the cancer cell's DNA, which is the root of the problem and where we want to address the issues. So that's where this is very interesting, because it does a little bit better of a job than, say, the teletherapy, because it's really focused and it's destroying the roots of the cancer cell. Biologically targeted therapy. This is some pretty interesting stuff. This is using radioactive therapeutic agents to deliver through normal biological processes. So this is where you're using your body and the body functions to work in conjunction with radiation to help destroy those cancer cells. So here you have certain drugs are used. Usually they're a radioactive isotope, and it's specifically designed to target parts of genes in cancers that are not working properly. For example, your signaling. So you have a cancer cell with proteins around it, and these proteins tell the cells what to do, what not to do. Certain genes that we've discussed, such as the tumor suppressor genes, which is supposed to be on in order to turn off or in order to stop tumors from growing. And the oncogene, which is obviously has to do with cancer cells, should be turned off. But in cancer cells, it's obviously turned on. So with this, you're using the immune system, the natural immune system, to help basically combat these signalings. And they come in and they basically attach to these proteins and block them from doing the certain signaling or self-signaling that causes cancer cells to proliferate and to thrive. So by using these proteins to your advantage and injecting objects that can basically block proteins from working is pretty fascinating stuff. And lastly, here we have what radiation is used for specifically. Now, in veterinary medicine, it can be used for lots of different things, but the most common malignancies in radiation are nasal tumors, brain tumors, and certain types of lymphomas. Obviously, you can use it for other things, depending on the situation with the patient and what the client prefers. But these are some pretty common ones that are used in veterinary medicine. And here are our references. This is for part 1.